I'm here to tell you about the art therapy program. I am a credentialed art therapist, as well as being a professor here at Ursuline. And a lot of people don't really know what art therapy is about, or maybe they think they know, they have kind of an idea. So I'm just going to start with a little overview of what the work of art therapy is all about. Artwork has always helped humans in our quest to survive and cope with life's challenges since the dawn of time. You can look at the cave paintings, the ancient prehistoric cave paintings in Lascaux, and look at the stories that are told there. And you can see how humans have always used art to survive and cope with a brutal world. And so the field of art therapy really is about studying those benefits and how they can be applied to various problems that humans face in settings where people who have challenges go for help. So art therapists work in this mental health profession in a variety of psychiatric settings, in a variety of trauma-based settings, in a variety of medical settings, in a variety of school settings, and also in wellness settings. You can find art therapists making artwork with clients, participants for a variety of, to address a variety of emotional, cognitive, social, and physical wellness goals. To become an art therapist, just as you heard Dr. Edmonds speak about the field of psychology, entry level for the work of art therapy is a master's degree. So here in the undergraduate art therapy program, we are, for the most part, preparing students to be successful in graduate study in art therapy or art therapy and counseling. About half, a little over half of our students do go on to study art therapy in graduate school right away. Some people wait a little while and then go on to graduate school after they've had a chance to work out in the field. But some students decide that art therapy study or graduate study is not for them, and they want to go work, apply their skills in other settings that don't require that kind of advanced degree. And so those folks find work in places, in various mental health agencies and education and special needs settings that don't require that advanced training or that license. For example, we just had one student who is actually a senior right now about to graduate. She did a field placement working in a setting that was a kind of a halfway house for women who were recovering from substance abuse. She ended up getting hired by that organization in an entry-level position and has been working there for the last year and just got promoted to the house manager of this facility. So, and you know, that is a student that's currently in our program and about to graduate. So that's the kind of work that you can find with an undergraduate in art therapy. It's really a pre-professional program. So our program, we have a major in art therapy, or you can minor in art therapy if you want to pick up a minor. The major is 51 credits, the minor is 21 credits. Our major is made up of primarily courses in the art department, 21 credits of art, studio art. And we really want our students to be artists first and artists in their core. We want our students to be proficient in working with a variety of visual art media, including drawing and painting and sculpture and all kinds of traditional fine arts like that. We have 12 credits in our program out of the psychology department. So every graduate school in the field of art therapy will require this minimum 12 credits of basic psychology courses. And so we have those as part of our major. And then 18 credits in art therapy coursework. And those credits will cover, those courses will cover information about the history and theory of art therapy, about art media and methods, the things that art therapists do and use that are different from things that art teachers use, different from things that fine artists use, that really work to make artwork accessible to regular people who don't have art training or don't consider themselves artists. We want to really put art in people's hands and allow people to really experience the benefits of making art, because art is just, it's healthy. It's a healthy human behavior. It always has been. I kind of think of it as like eating fresh fruit. You know, you need to do it every day. It's good for your body. And if we make a little art every day, if we find a way of being creative, then that's also good for our physical and mental health. In addition, in our courses, our students develop skills in what we like to call aesthetic fluency, which means that our students are really good at expressing themselves using art and are good at looking at other people's artwork and really getting a sense of what that person is, what their strengths are, what they may be struggling with, and being able to talk about art as well and talk about other people's art with them. So this is kind of an aesthetic fluency skill that we're addressing. Our students develop really good communication skills, not just in addition to writing, which is an important creative communication skill, also the interpersonal communication skills that we need to have in order to work in a human services profession. Also developing professional presentation skills and professional communication skills as well. So writing research papers and presenting at conferences, also part of our program. And one of the main skills that our students are developing in our art therapy courses is called community art facilitation. This is really the groundwork that prepares students to become art therapists. How do you run an art group that's going to be successful for people with special needs? How do you run an art group that's going to be successful for anybody? So we teach our students the fundamentals of that, and we have 2 courses where our students get to go out in the community and work as an assistant to either an art therapist or a qualified art facilitator out in a community organization that, that serves people in some way. So we have a 200 level course called Art Facilitation with Diverse Populations, and we have a senior level course that's a field placement where our students go out and get really good experience and really wonderful mentoring that happens where we pair our students with supervisors in these agencies who become professional mentors for them for the rest of their lives, really. So our students get to work in a variety of educational settings with these 2 placements, a few schools across town, working with people with physical challenges, mental health challenges, or just in regular school classes. There are a number of art therapists working out in schools that are functioning as art teachers in their schools. And so our students get a chance to work with those folks. Our students work in also in some art gallery and art studio type settings out in the community. And our students work in various elder care facilities across Greater Cleveland. Our undergraduate program grew out of our graduate counseling and art therapy program that is over 30 years old. And all of those graduates of our counseling and art therapy program are out working in the community. And so we get to pair our students, our current students, with professionals that are working in the field. So there is already a huge network of mentors and a whole variety of settings that our students can have an opportunity to work within and learn from. So that's one part of our program that really makes us special and unique. We also are housed in a very new building. The Parker Hannafin Center for Healing and Creative Arts and Sciences is just a few years old. And our classes are held on the top floor of that with lots of studio space, lots of art supplies. We have a kiln there, we have printmaking, we have collage, we have fiber art. I have a whole room of fiber art, which is my personal passion. So lots of different creative processes to learn about and explore and begin to learn how to help others do as well. So I think those are the high points. Thank you for listening. Thank you for this opportunity. And if you have any questions, I'd love to talk more with you.